Depression is a subject that gets everyone squirming in their chair. No one really knows how to talk about it. I asked myself, how is depression treated? How do we respond to people with depression? Here's what I found. First off, we should discuss what causes depression. There are many things found to cause depression. Abuse, medications, conflict, death, loss, genetics, major events, personal problems, and substance abuse, among other things. These things can cause a person to feel a heavy drag in their life. A lack of energy or motivation to do anything, as well as a feeling of dejection, is very common for those with depression. The good thing about depression is that there are many ways to help someone struggling from it. In an official visit with a doctor, a patient will first be assessed if there are any other ailments that a person may have that is causing the depression. If not, the doctor will prescribe medication or counseling for the patient. How does this medication work? Chemicals in the brain that help mood are norepinephrine, serotonin, and dopamine. Prescribed medications are known to boost these chemicals to cause a person to have a mood of positivity. For people with less extreme cases of depression, there are many helpful tools to fighting these feelings. Setting goals for yourself, such as making time to walk around the block, are found to be very beneficial. Other important things would be to challenge the negative thoughts that come to your head, get active, eat healthy, and finding multiple supportive friends. That brings up the point, how should these friends act? Well, silently ignoring the problem is not the answer. For a supportive friend, remember these important things. Get involved in the other person's life. Ask what the person needs. Offer to help with practical things like doing their AHS homework. Know your limitations you have, and take any threat seriously. You may feel helpless, frustration, anger, fear, guilt, and sadness when trying to help someone with depression. But know that depression isn't just switched off overnight. It can last for a very long time. How do you know if someone has depression? Oftentimes you won't. Many people struggling with depression will smile and look happy all of the time. Should you worry about hurting someone with depression? I would hope not. If you feel you have to be less mean around a person with depression, you may want to reevaluate how you treat others. Always treat others with kindness and love as God has shown for us. Remember that God gave us all a plan for our lives and that each of us are important and loved.